good. Okay, video call, just see. Okay, you can touch, maybe in the future you can touch the sensor, automatically the sensor itself will scan and will send the report to doctors. Then it's easy for doctor to evaluate, to check the report, okay, and will prescribe the medicine. You just go to the nearby pharmacy and you can collect your medicine. Integration with IoT, okay, IoT device and telemedicine by providing the real-time health data from patient to healthcare provider. On the spot data will be given, okay, even for your mobile phone will collect your data, even about steps, your pressure level past 1 month. If they need the data is available. Even for 1 month, 1 year data will be available. Doctor can see the pattern. Okay, when your pressure is going up, when your pressure is going down. Okay, all that doctor able to monitor and give you the proper advice. Okay, proper advice. But you need to, most of the time they have an application inside your mobile phone so that doctor able to recognize, able to see the information. Information always the wealth. Okay, information. Without information, doctor is not able to review the patient. Okay, IoT-based telemedicine, okay, Internet of Things, okay, is a network interconnected device that collect and share the data among the doctors, among the caretakers, okay, to the company. A lot of places the data can be shared. In the telemedicine, IoT device will monitor and transmit the patient data about the heart rate, blood pressure, glucose level, okay, healthcare provider, okay, in the real time you able to send the information. Until now, glucose level still don't have the 100% accuracy. 85%, 81 point something able to have this kind of percentage. Okay, not like 100%. Yes, you have a blood pressure, you have a sugar is very high. No. For the sugar level, you need to go for a blood test. Without blood test, no accurate data. Okay, it's surrendered by one of the smartphone provider and one of the smartwatch provider. They say the accuracy is still 80%, but glucose level should be by blood. Okay, blood need to check. Okay, to provide the continuous personalized healthcare remotely, other people won't listen what you are talking to the doctor. Okay, and the doctor can advise you personally via the video call. Okay, that's the main objective. Okay, you don't need to travel, even you're having fever, but still the blood, they need to take the blood. Okay, in some situation, rural area, what they are doing, they send the nurse to the home and take the blood, but there is a charges. Okay, with the help of online telemedicine. Some history about the telehealth remote patient monitoring. It's not new actually. Okay, it's not new. They already started in the year 1974. Okay, doctor in Australia treated the wound, patient via, okay, marking the first documented telehealth services in the year 1874, and followed by two-way communication through radio enabled doctors to treat the patient. Okay, those on the ship, okay, in the 1920s. That time also the remote are supporting, okay, already available, and followed by 1950s, okay, introduction on the two-way video, okay, communication using the closed circuit TVs. Okay, advanced telehealth in the universities, educational institution in the US, they already tested in 1950s. And during 2019, okay, 2019 is the most very big period of time. Okay, COVID pandemic. Okay, not only India, not only Malaysia, throughout the world they are suffering. Okay, patients are very scared to come to the clinic. That's why doctor connect to online to view the patient. Okay, but some tests still they need to come to hospital or nearby clinic and so on. But the modern healthcare started from 2019, okay, in Malaysia, okay, especially in Malaysia, because I know the pattern, okay, what is going on during that time. Okay, a lot of things, a lot of sacrifices, okay, during the development part, and we have some application as well. In My Sejahtera application, it's called My Sejahtera application. Under the application, you can book the appointment, Okay, you can request for the doctor will come on the requested time for you. Okay, a lot of things they have modernized, okay, under the healthcare application. Okay, starting from 2019 onwards. Now it's become very famous. This is the history, okay, about monitoring. Okay, telemedicine and remote patient monitoring ecosystem. Okay, what patient like it, okay, about the telemedicine? They are enjoy, okay, because they no need to take the number, you no need to wait in the queue. Okay, doctor will come to you, okay, via online. Okay, whether you are coughing, you are fever, doctor will come first. Okay, the doctor will come via online and will give you a support so that you will be cure fast. Pharmaceutical, okay, telehealth facility, clinical trial, okay, delivery, okay, traffic for distance patient, everything will be delivered on time, and they will monitor some of the critical case. They monitor, okay, doctor will monitor, nurse will monitor, okay, there is a camera, fall detection camera as well, anything movement camera, a lot of camera they will fix and monitor. Doctor will be outside, but nurse will see, okay, the condition, okay, what's going on, and so on. Healthcare provider such as doctor and nurse are able to efficiently manage the multiple patients across the various time zones, because they will just fix and the data will be given by the IoT device. From the sensors they will receive the data, maybe 2 hours once, 3 hours once, okay, the data will coming in. Okay, maybe you are in a different state, okay, but this doctor will see you. Okay, because you are in rural area, this doctor able to see. For this doctor, maybe 100 patient, 200 patient data will be coming in. Then based on the graph, doctor will call, okay, this is a very critical, just come to the clinic or hospital. Payers, okay, healthcare, RMP, known streamline process. Each time visit, okay, you need to take good care. Okay, there is a costing involved. Okay, and nothing is free in this world. For each and every doctor consultation, you need to pay. For example, 50 ringgit, 60 ringgit. Okay, it's a QR pay. Okay, if no, then they will they will cut from the online banking. And telemedicine platform, first it's a cloud. Okay, all the hospital, clinic, physician, okay, medical equipment, ambulance, home, patient, everything connected to cloud. The data will be in the cloud. Okay, whatever information you want to send, you want to receive, you want to upload, everything will be cloud based, because our application is a cloud based application. Okay, that's why it will count under the cloud base. Okay, connected device IoT enable the platform integrated medical devices. Okay, stethoscope. Okay, stethoscope online. You can get it there. Stethoscope. Whether the accuracy level, I'm not really sure because I did not test on the stethoscope. Okay, thermometer, yes, I touched my sensor, it's going up. That means, oh, okay, I'm having fever. Okay, this is how you need to touch. Okay, it's installed and you need to touch. Okay, pulse oximeter, yes, it's working. Okay, telemedicine platform. Okay, doctor can conduct the virtual examination. Okay, whether you are fine, you are not really good, you need to get the treatment, on-site treatment, off-site treatment, everything doctor will predict for you. It's easy for you. Okay, because the data is available, not only the current data, maybe 10 years data, they can compare with 10 days, 10 years data. Okay, doctor will see. Okay, that's why it's a virtual one. It's really good. Okay, if you ask me, because I practiced last year, I was practice on this. Okay, because my area and hospital quite far. That's why. Okay, cloud-based. Okay, patient data from the IoT device. Okay, will store in the cloud. Okay, easily your healthcare officer. Okay, doctors able to view the information on the spot without any issues. Okay, key component of IoT-based telemedicine. Okay, IoT-based telemedicine. We have a wearable. Wearable can be your smartwatch. Okay, smartwatch, ECG monitor. Okay, smart thermometers. Okay, everything will have the sensors. Okay, and useful for the medical instruments. Okay, all the sensors you need to hold, you need to touch, so that the data will transfer to the medical officer or nurse. Okay, will get the information. And cloud-based storage, we have a data storage that allow access to the health information. Okay, from anywhere in the world. Okay, not only in Malaysia or in India, but anywhere in the world, the data, okay, you can send without any problem. Okay, even for the blood sugar level, another device, it costs around 60,000 rupees. Okay, 60,000 rupees. You need to touch it. It will give you some accuracy level 90%. Okay, based on the one of the studies is 90% accuracy. Whether your sugar level, that now the sugar level is going up or going down. Once it's recorded, automatically send email. Okay, the email you will receive, then the doctor also will receive the email. The device, telemedicine platform, okay, remote consultant, okay, consultation, video call, messaging, okay, it's help on that as well. AI analytics, okay, data analytics, okay, tools to predict the health trend and assist the diagnosis. Okay, AI and analytics, okay, will give you some prediction. Okay, if this blister and this blister, what's the blister? You take the picture and send automatically, the AI will give you some treatment, some explanation, and some information about the blister. Okay, why this blister, how come can cure, how long it will take, everything. That's why we need to train the AI machine. Okay, we need to train the AI so that you can get the accurate treatment, okay, with AI and analytical. And followed by how AI IoT enhance the remote healthcare. Okay, how IoT enhance the remote healthcare. We have a remote patient monitoring system. Okay, now most of the government hospital, private clinic, not private clinic, a certain private clinic and private clinic, government clinics already have online monitoring system. Okay, online patient monitoring system. Okay, continuous monitoring the chronic conditions. Okay, whether you are cancer patient, they will monitor. Okay, because no bed. Okay, no bed are not available because it's always full. Okay, always full. Only critical patient below than 50 years old will get the place. If above 50, you can just monitor at home, then they will see from the camera. There's some strategies, some issues, again, going on. Okay, still going on. Real-time data transmission. Okay, each time the data collected from your mobile phone automatically sent to the cloud. Transmit, automatically transmit, on the spot transmit. Okay, it's very fast, but depend on your internet. If your internet service is very good, on the spot you can send. If it's delayed, then it will take some times. Okay, it will take some time to just go in. Okay, we'll hang here, hang there. Sometimes in between there is a data loss. If data loss, you know, okay, the doctor not able to see the actual data. You need to resubmit again. Okay, if the data is available, then you need to resubmit. Some of the application direct. Once you take, automatically send. It won't record. Okay, won't record. And personalized care, okay, tailored treatment, okay, plan based on the data from the IoT devices. And we have for emergency healthcare, okay, immediate alert for the critical health condition. Automatically, the healthcare personnel will come to your home. They are supporting for 24/7, right? If any critical situation, the alarm is triggered, red alarm, then automatically the doctor will be there, maybe doctor or medical officer or nurse. Okay, they will just bring in the device. It's normal practice. Every also there is a normal practice under the emergency healthcare for the support purpose. Benefit of the IoT telemedicine, okay, it's improve the access, okay, access to healthcare in the remote areas. That's the most important part, the remote area, villages, okay, no hospital, no clinics. That's why in the remote area, automatically you will get some support from the doctors, online doctors. And it's cost saving. You don't need to travel. You don't need to park. You need no need to find for the parking. Don't wait for the numbers. Nowadays, all the numbers will be online. Okay, online number. You can just pick from the online. Wait for the doctor. Doctor will call you because you will key in your number. Right? Then doctor will call you. Nowadays, not patient call the doctor. Doctor will call the patient. But you need to stand by during that time because you already booked your appointment. Each day, one doctor able to see more than 50 patients. Okay, more than 15 patients within 12 hours. Okay, within 12 hours, they need to see the patient. Better healthcare outcome. Okay, continuous monitoring. Even every day, doctor can see. Then every day, if you are not in the not good situation, doctor will see you every day. It's better. Okay, it's better. And the monitoring approach will detect the early detection. Okay, if you have any issues, early detection. But don't ask me if cancer can detect. Cannot. You need to do some of the testing. It's very important and enhance the patient engagement. Okay, patient activities, participate in their care and real time. Okay, data insight. Example of IoT device in telemedicine, we have a wearable device, okay, smartwatch, Apple Watch, Fitbit for tracking heart rate, fitness, okay, all that. During you do exercise, okay, if you do exercise, automatically everything will be recorded, okay, whether you playing badminton will be recorded, okay, if you are jogging, okay, it will be recorded. Each and every step you do, able to record. You climb the staircase, will record. Okay, so then in the average, the system will give you some average. Okay, you already fulfill A, B, C, D. Okay, normally the Apple Watch lah. Okay, will have some calculation. Will give you you are fit enough for today. You already completed. You will get the some online batch. Okay, you receive that. If you did not, maybe 1 hour. I'm just sitting. I did not move. The system already trigger. My phone will tell me. Okay, you did not stand for 1 hour. Please stand and just move your eyes here and there. You're always referring to the monitors. A lot of information, okay, a lot of information the system will give you because your phone and your wearable device, your watch is connected to internet. If internet, then the system will trigger you from AI or from the online, will give you some messages, okay, good messages, good morning messages, okay, your health messages and so on. And thermometer, okay, smart thermometer, okay, like Kinsa for taking temperature remotely. Okay, if you have, it's called thermometer with the sensor. Once you that one need to connect to internet as well. Okay, once you touch this one, okay, automatically you will take the temperature and send it to your personal doctor. ECG monitoring, yes, we have a cardia mobile for the heart rate activity, whether your heart rate is okay or not. Nowadays there is a belt, okay, for you to wear from back to in front here. Okay, if you can see, okay, here the device will be here. Automatically it will record, okay, for 24 hours. Record, stop, the data will send to your doctor. Okay, this device, I'm not able to remember the name. Okay, this device is expensive. Only private government hospital available. You need to pay for the services, and they will help you to put. Okay, to monitor. After it's monitored, if you did not connect to internet, automatically data will be there. You can give it to them. If you connected, automatically the information will go to the doctor for the ECG part. Blood pressure, okay, we have our own blood pressure, okay, the device, Omron, or you have multiple devices. You can just wear it. You can, that one for the pressure part, we don't have some sensors. You need to put cuff and you can just scan it. Easily you can do within to blood sugar level, okay, there is a device, okay, you can just take your blood and just test at home. Okay, that's a strip. You can just scan and just put it. Okay, you can get the accurate level. Okay, whether your sugar level is up, down. Okay, on today's you let's say you might eat anything sugar. If you anything sugar, then the sugar level will go up. You can test from home. And IoT, IoT chronic disease management. Okay, diabetes. Okay, diabetes continuous glucose monitoring system. Okay, CGM, it's available. It will send the data to the doctor each and every time. It will send 2 hours once. Okay, based on the data set, I can see the system will able to send 2 hours once. The system will check and will send. Okay, glucose monitoring each time you press. Okay, it will send the information. Heart disease, remote ECG monitoring. Okay, how to track the health. Okay, whether how is your health. Okay, whether your heartbeat is very high. Okay, very low. And asthma. For the asthma, there is a smart inhaler. Okay, but the inhaler you need to buy. Okay, smart inhaler you need to buy. Okay, and the sensor. Okay, will monitor. Okay, and doctor sometimes the sensor, if you bring to your nose, it won't work. The doctor need to give the permission to the sensor so that whenever you bring to your nose, it will be automatically will be pumped for you. If no, then that particular inhaler won't work. Okay, that's why they fix the sensor. Only doctor need to review your current situation, then only she can give you the permission to pump. That pump also you need to keep its pump by itself. You don't need to press. That's another good thing about the asthma, because one of my friend using that. She said I cannot press anything. I need to get the doctor need to press some magic. Then only when let's say you near to your nose, it will be get the medicine. Yeah, it's controlled by the doctor side. If not, then patient can price fine. That's why. Challenges. Sure, 101% there is a challenges. Data privacy and security. Whether it's protected or not protected. Protected, yes. Not 100% protected. The data will be travel. One place to another place. In between, people hack. Yes. Can I modify the data? If I able to access into the cloud or something, I can modify the data. That's the main thing, the security and data privacy. Some of the part, the data are leaked out in the dark web. You can see the dark web from the patient data, it's out. Patient's phone number, it's out. Patient's health condition, it's out. A lot of things. If you need not protect, automatically the data can be anywhere and everywhere. That's the main challenges. And connectivity issues. If internet connectivity not stable, how to monitor the real-time monitoring? That's one of the major issues. Major issues. That's why you need to check your internet connection always. If connection disconnected, automatically no connection between doctor and your device. You need to reconfigure again. That's another part. If each device is already connect with the SIM card, then no issue. Your internet connection remain on. Doctor will advise whether you want to use wireless or SIM card. If SIM card, even better, is a small one. You can use it without any problem. Data accuracy, device accuracy, ensure the reliability of the IoT to accurate data collection. The accuracy is still not reach up to 100%, still 80%, 81%, 90%. Yes. The regulation normally you can see the standards. Malaysia have the different standards. Singapore have the different standard. US have the different standard. India have the different standards. You need to fulfill all the rules and regulations. It's very important. Without regulation, you cannot use that particular device in all the countries. That's why the standard is very important. For example, CE certificate, certificate of Euro, wireless certificate, IoT. Before you do something, then you need to prepare all that. Benefit of IoT, healthcare, telemedicine, virtual consultation. It's one of the easiest for patients. Full connectivity. You have full internet connection connectivity to see the doctor, to talk to the doctor. To get the proper advice. Within 15 minutes. You need to get all that as well. Mobile health care. Mobile health checkup. You can use your mobile to check, and through the mobile you can have yes, no. You are having fever? No. Are you coughing? No. You are depressed? No. Everything you need to fill up. Then only the system will generate you are perfect, or you have asthma, or you have depression, and so on. Mobile health checkup. I tried work with one of the application. And followed by its help for the live tracking and alerts. Live tracking means all the sensors inside your body, right? It will be tracking, your current condition. Whether you are perfect or you need some attention. Automatically will trigger the alarm for the doctors, your personal doctor. Then providing the support for the elderly people. For example, old people at home, then they fix the fall detection. That means anyone fall, automatically the system will trigger some image to the doctor, ask someone to send the ambulance, something like that. There is some application. With help of IoT devices. IoT devices, doctor monitoring, patient side monitoring at home, all that. If you fall, only automatically will be triggered. and followed by appliance maintenance. Okay, and then normally you need to do the routine maintenance so that the system will be good, accurate, without any issues. Okay, it will check time to time. The system will check and will give you some good information. The report weekly once you will receive the report without any issues. Okay, future trends in IoT based telemedicine. Okay, what will be the future? The future will be 5G technology. Even we are talking about 5G, people already go to 7G technology. Okay, not even people talk about 6G, 7G technology. We already have the 7G technology. In China, they are going to implement 7G technology, but in Malaysia, still we are on 5G technology. Okay, it's very fast and more reliable network. Okay, will enhance the data transmission. Okay, AI and machine learning. Okay, automated diagnosis. Okay, predictive. Okay, analytics and personalized treatment. Okay, I will be recommended by the AI and machine learning. The accuracy is based on my understanding and my analysis. It's almost 90%. The accuracy using AI is a 90%. Even some doctors don't know. Okay, what this one? I'm not really sure. Something. The AI will tell you what's the exact issue. Okay, if you put the accurate information, then you'll get the accurate one. Integration with the wearable. Okay, integration with the wearable, greater use of wearable health devices. Okay, for the continuous monitoring and global healthcare accessibility. Okay, increase the telemedicine adoption in rural, okay, underserved areas. Okay, but first of all, the telemedicine. First of all, think for the rural area. Okay, they are focusing rural area because of transportation. Okay, connectivity. Those days, yes, there were some connectivity issues, but now they already implement. Okay, where they already implement internet services everywhere, in the, especially on the rural area, so that they can meet the doctor regularly. When medicine, they will send regularly without any issues. Okay, that will be more perfect support given by most of the government in the world. Is robotic surgery is a telemedicine? Okay, if you ask me, yes, because using technology. Okay, the robot will do the operation. Okay, it's already trained. All the information are trained. Okay, every day we are trained the machine. Okay, the robot, we are trained the robot. Okay, we train the robot during the cutting, during the surgery, each and every movement. Okay, whether it's accuracy is 100%, but 95%. Okay, during the surgery is 95%. Okay, 95%. Okay, telesurgery is an extension of telemedicine. Okay, telesurgery is an extension of telemedicine. Okay, telehealth concept that has become possible with the advancement of surgical robot. Okay, under the sophisticated telecommunication technology. Still, some of the places they are using a robot, okay, to do the surgery. Okay, if you are good enough, you can accept the robot, then still you can go for the robotic, no problem. Okay, in case the robot not able to show you the love, empathy, sympathy, the robot won't know. Okay, if doctors able to give you, show you empathy, sometimes will show you the sympathy, all that doctor able to give. But robot, they won't. Whether it's cut wrongly, then cut, that's it. Your life will be gone, that's it. Okay, that's why still the robotic testing still going on. But the small surgery, yes, they already doing some testing. Okay, train the AI. Okay, and if you remember, there is a smart vehicle as well. Okay, there is the AI will control the car and go, but still some people very scared to use. Okay, small short distance, yes. Okay, short distance, yes, but not very far. Okay, still under testing as well. Can AI, can AI be used in telemedicine? The answer is yes or no. Yes. Okay, AI, yes, under the telemedicine. Okay, nowadays people are using AI under the telemedicine. Okay, even doctor itself they check, okay, information, okay, what medicine, okay, they also learn everything by AI. Okay, AI most of the time, okay, will improve the telemedicine by enhancing the diagnosis accuracy. Because in Malaysia, maybe the diagnosis will be different. Maybe from US, the diagnosis will be different. Okay, that's why they want to learn and they will give you the proper advice. Okay, it's one of the good implementation. Okay, AI under the telemedicine, the accuracy, okay, enabling the remote patient monitoring, analyze medical imaging, providing the virtual triage or medical consulting service, and more. A lot of things you can do under the AI telemedicine. Okay, the accuracy you can get almost 90%. If you're using AI, 90%. Okay, if it's a trained AI, then 90% no issues. Okay, you get whatever you want, whatever idea you want, all that you will get. Okay, without any problem. And it boosts, boosts efficiency, accessibility, and quality of telemedicine services. Okay, this improvement is really, really good under the telemedicine as well as under the use of IoT. Okay, it's happened to me on 20 December 2024. Okay, on 20 December, I undergo the semi-major operation. It's not major, it's a semi-major operation. What happened? During that time, I'm not able to go to hospital because hospital is almost, for me, it will take 150 kilometers. Okay, each time to visit the doctor, okay, it will take 150 kilometers. The jam is terrible jam. Okay, it will take more than 2 hours. That's why I won't go and see the doctor. What I'll do, I just call the doctor. I just, with my phone, doctor will check. Okay, doctor will say, okay, what's the issue? Oh, yes, this one, okay, we can do. But I don't have any sensors. For this one, the sensors, I don't have anything. I use like blood pressure, then for heartbeat, okay, I use another oxygen, okay, another device, okay, and so on. Doctor monitor, okay, all the pictures I send, okay, video, I show some of the part, okay, this is happening and so on. He just monitor and he detects something. Okay, he detect, oh, okay, can you come to hospital? I detect something. Okay, if I'm not mistaken, this is your problem. Okay, it's an intestine issue. Okay, I suspect, okay, this is the issue. Because of this, you have these symptoms. Okay, he recognizes. After that, he do some prediction. Okay, during this particular time, okay, you need to have this kind of issues. Okay, after I come back, I just monitor. He called me. Yes, he say, oh, okay, it's predicted. Then he gives some solution, that diagnosis. Okay, after that, still it's not able to prevent using some medication. No, it's not working. Then I go undergo the surgery. They cut the intestine. They already cut this much. This much. Okay, sorry. It's cut and they already do some surgery lah. Okay, they already cut the twisted one. It's thick and they already cut. Okay, they insert some of the screws and so on for this particular treatment. Okay, last month. Okay, 20 December. And after that, they for the prevention part, they give some medicines. Okay, to overcome all these and so on. This is why actually I'm undergo telemedicine environment. Okay, and the conclusion, okay, IoT-based telemedicine is transforming healthcare by providing the remote, real-time and personalized care. Okay, that's why IoT-based telemedicine is really, really good under the transformation. Okay, 5G transformation, AI transformation. Okay, all that IoT-based telemedicine is one of the good. And followed by the integration of IoT and telemedicine has the potential to improve the patient outcome, reduce the costing, not only for human, okay, as a government, okay, they will reduce the costing, okay, the petrol, in terms of petrol, in terms of the parking money for the consultation fees and so on. If a government doctor, no charges FOC. Okay, increase the healthcare access. Okay, globally, you no need to monitor only Malaysia. You can monitor Singapore patient. You can monitor Vietnam patient. Okay, you can do all kind of these kind of services. Okay, global doctor. It's called global doctor. You can refer to anyone if you are good enough. As a technology advance, IoT-based telemedicine will play the critical role in the future of healthcare. You know, right? Blockchain technology. Okay, we have 5G technology. Okay, all that you can improve on the security part. And IoT in healthcare, okay, revolutionize patient care, okay, enhance patient monitoring. IoT device, okay, provide the real-time data for effective remote monitoring of the health metrics. The data, okay, whatever data provided by IoT, okay, the data will be analyzed, okay, analyzed. The data will be massaged, will give you the accurate information. Inaccurate information, the system won't trigger anything. Okay, it will just analyze, predict. Okay, now using the AI and machine learning, it predict what is the issue. Then the AI will tell to the doctor, maybe this is the issue. Okay, with the real-time data. Okay, this is the enhanced patient monitoring. And data security and privacy, still some of the data will be encrypted and secure protocol to protect the patient's data. But still, if you want to hack in between with the encryption, still you can have some issues. Okay, still people can steal the data. Telemedicine expansion, okay, foster efficient remote consultation, especially in retail during the health crisis. And innovation health devices for glucose meter and heart rate cuff, okay, IT device aid in a continuous health tracking. Okay, the heart rate cuff you can buy. Okay, glucose meter. Okay, the price is not that expensive. Still, you can buy and you can keep. Sometimes the hospital itself will give you, okay, all these devices so that you can just monitor at home. If you are rich enough, then the doctor will give from the private hospital, not from the government hospital. Government hospital, most of the time, will give you the consultation. If anything, patient need to go to clinic. But private, they will give all these devices with charges. Improve the hygiene control. Okay, IoT ensure the sanitized environment by monitoring hospital cleanliness. Okay, will be always clean. Sometimes you don't need to come to the hospital. Sometimes you can just sit at home. Okay, just refer to the issues. Okay, you can just monitor what's going on. Overcoming challenges. Okay, data latency. Okay, data interconnection, centralization in the healthcare setting. Okay, maybe some devices have some issues. For example, under the blood pressure, okay, we have several brands from the expensive one until the worst one. Okay, which one will give you the more accurate information? Okay, it's depend what your doctor prefer. Okay, what your doctor prefer, that's important to cater, okay, for which glucose meter or pressure device you need to use. Even your smartwatch able to detect your pressure. How accurate it is? Only 80% accuracy. Okay, only 80% accuracy. So that we cannot depend on the smart devices, because smart devices sometimes did not connect to internet, sometimes have some issues. Okay, so that we can use our manual, okay, and with the smartwatch, you can compare the result. If you compare, most of the time you able to get some idea. Okay, and IoT in healthcare, okay, promises efficient patient care, enhance the security, and feature with the digital health solution. Okay, it will promise the efficient patient care. Okay, most of the time will give you 100% support. Okay, 100% support, 100% care. Okay, no, most of them they will have empathy lah. Okay, empathy, and will give you some good advice. Okay, some good advice so that you can understand better and reply to the doctor. Okay, reply to that doctor based on their advice via online. Okay, the famous online thing, okay, online scanning, all still they're using only video pill. The video pill you can get it from the hospital, video pill. Okay, and still for the blockage, all you need to go to hospital. Okay. Stress management, yes, you can do online consultation. Okay. Diabetic management, yes, you can do online. Video scanning, okay. The scanning, if your phone is connected, then the data will be recorded. Okay. Once you're already in the stomach for 24 hours, 10 hours, it will be see all the processes. Okay. Some of the scanning, you're able to use the telemedicine. Okay. The support's really good. Okay. Any questions? Hello, everyone. Any questions?
Participants, do you have any questions? Please interact with our session talk. So present here, Dr. Nagar.
Sir, good evening, sir.
Good evening, sir.
So actually, I mean, I have one doubt. You telling that the accuracy of the devices are 90%. So how can we rely on these devices if the accuracy is up to 90%?
Well, actually, based on the research, they only show 90%. It's not 100% accuracy. It's still doing some research. Research is still going on. Even our smartwatch also, the accuracy is less than that. But they mentioned that 90%, but still on the connectivity, okay, whether your watch is still touch on you and so on, sir.
So is there any chance to give the wrong prediction of the devices like Google Maps? Because in recent days, in India, Tamil Nadu, one incident occurs. So the Google Maps showing the route ends in some bridges constructing in a river. So unfortunately, I mean in the car, 4 doctors are there. They are fell into that river and they lost their lives, sir. So can we, I mean, what my doubt is how far it is reliable to, to accept these devices for the sake of human life.
If you ask me, the reliability, it's depend on people. Depend on the device, depend on the brand. Some of the brand, okay, the reliability will be more higher. Okay, the connection is another part, as you mentioned in the Google Map, the bridging and so on. But depend on the connectivity as well, whether they already update, okay, the firmware, okay, the application already updated or not. Okay, all that will take into the count. Okay, for all the testings.
And one more question, in your knowledge, so the telemedicine is feasible in India or not? Because we have in India so many remote locations are there. There is no internet facility, but the concept is very good because we are avoiding the long queues in front of the OP rooms, all those things. But the things should be improved a lot. But I think it is somewhat difficult to implement in the India, whatever the concept of telemedicine. So as far as your knowledge, in how many years it will take to implement, I mean in a somewhat manner, please tell me, sir.
Sir, based on my knowledge, in Malaysia, they already implement this. In India, in rural area, first of all, we need to implement the internet connection reliability. Okay, internet connection is good, then we can implement that in India. If you ask me, maybe within another 5 years time, 5 years time, you can see all this technology. However, based on my knowledge, India got a lot of hospitals, a lot of government hospitals, a lot of private hospitals. They will really worry to implement this kind of services. Okay, if they implement this kind of services, okay, more people won't come to the clinic. They will do the free consultation. Okay, that's why they're quite worried. It will take maybe 5 years or slightly more, but somehow they need to implement this because populations and connectivity.
Okay, sir. Okay, thank you. Actually, today's session, this very informative, and your lecture is also very good. We are very thankful to you, sir. Thank you.
Thank you, sir. Okay.
Hello.
Yes, sir.
Hello.
Yes, hello, sir.
Sir, one question from my side, sir.
Yes, sir.
Sir, till now, what I have understood from this session, basically, first of all, the IoT requires first the internet connection for the user.
Yes, sir. We need the
And
internet connection, sir.
yes, sir, for the IoT, all the IoT devices will require the internet connection. And if a person is patient is there who is not affordable for this expand on the uh, IoT devices, then he cannot use them.
Cannot use, he or she need to go to hospital, sir.
Okay, sir. Okay,
But in
sir.
Malaysia, also in Malaysia, only the private hospital provide this kind of services. But in private hospital, only rich people can go to the private hospital.
Yes, sir. Yes, sir. Yes, sir.
Yes, sir. But government only give you free consultation. That also with the appointment is 50 appointments from each clinics. Okay, we have more than 498 clinics. Okay, for that's from one part of Malaysia. Okay, we have 490 clinics, 490 clinics, but still each day only 50 only they are giving because of lack of doctors.
Okay, sir. I want to one more question, sir.
Yes, again.
Uh, as the IoT device is only helpful for the assistant of the patient.
Sir, can you repeat again, sir?
Um, all the IoT devices are
Okay.
basically for the healthcare in the acting as the assistant for the patient, but actually are not uh, perform the any doctoral activity on the patient.
Yes, correct, sir. It's Aziz to get the information.
Okay, sir. Okay, sir. Thank you, sir.
Okay, sir.
Thank you.
Any questions? If no question, I have a questions for everyone. Okay. If no questions, right? Okay, I need to share something. Okay, I will share something about postdoctoral. Okay, in case anyone interested under the postdoctoral studies, okay, or to become an adjunct lecturer, adjunct professor with UCSI University. UCSI University is ranking 265 in the world and second top ranking university in Malaysia. Okay, if you are interested, you may submit your application or request for this particular email. Okay, kraenu@ucsiuniversity.edu.my, and my WhatsApp number and my call number, you can just use +6012577822 if you are interested. Actually, we are more willing to support. Actually, I heard from Dr. Anil. Okay, we have lecturers from throughout India. Okay, this is one of the opportunity for postdoc and adjunct professor. There is a payment as well for adjunct lecturer and guest lecturer. Okay, from India, you can do remote teaching for 10 hours within one semester. Okay, any question, please update me.
Thank you, sir. Thank you, Dr. Renu, sir.
Okay,
So
thank you,
it is
sir.
for you in Malaysia. So I request you for the session talk. You are agree and given the talk for our participants.
Okay, sir. Welcome, sir.
Thank you very much, sir.
Thank you, sir. Thank you.
Thank you.
Right. Okay, sir. Thank you.
Okay, thanks.
Okay, sir.
So dear participant, next session will be started by 7:30. So the topic is telemedicine practices enabled by an Android by Dr. Chinmay Chakrabarti. So Bits Mishra. So we'll start the session at 7:30. So 10 minutes break. Thank you. Yeah, dear participants. So yesterday, Dr. Chinmay Chakrabarti sir has taken one session. So that is challenges and barriers to the development of telehealth sector. Now Chinmay Chakrabarti garu take over the another session. So that is session 6, telemedicine practices enabled by an Android. Now that Chinmay Chakrabarti are available to take over the session. Sir, welcome you, sir.
Very good evening.
Yeah,
Is
good
it
evening, sir.
audible?
Yeah, audible, sir. So please start the session, sir.
Yes, screen is visible.
Yeah, visible, sir. So for
Okay.
your information, sir, for this meeting, before this, Dr. Renu Kodalaswamy Garu is the director for UCSI University, Malaysia. Just now he has completed his talk and is so connecting now to listen your talk also. Now he's in the meeting with us.
Is it okay?
Yeah, okay. Please start, sir.
Okay. So very good evening, participants, dear participants, and I'm very much thankful for inviting prestigious session regarding telemedicine and telehealth is organized by Dr. Anil. Yeah. So in the yesterday we have discussed the challenges and barriers of telemedicine, means your telehealth systems. And today we will discuss telemedicine practices enabled by the Android. So basically from telemedicine, and we will spare a couple of minutes basically, the telemedicine for the discussion of the telemedicine. So telemedicine basics and what is the purpose and case study related, and we will discuss. Next, telemedicine basically it utilizes the information and telecommunication technology to transfer medical information for diagnosis, therapy, and education. And telehealth and telecare system, here ICT, in the help of the ICTs, and then that is how to transfer the medical information from one side to another side, one patient-centric zone to another patient-centric zone via a proper communication media that we have been discussed. Telemedicine, tele means where, so we can process the medical information through the proper communication path. And you know that is a transmission media can be categorized in two parts. One is your guided media, another one is the unguided media. Guided means your twisted pair coaxial fiber optic that you know, and unguided means your air bus space. So that's why this is the communication path. So our objective is that how to extract the information from the rural area and how to process that kind of information to the urban area. So what kind of problems are there in the rural area? So that's why one is your unavailability of doctors, nurses, general practitioners, and specialized doctors in rural and semi-urban areas, and waste of time and money by villagers who are urban poor for the appointment. Non-emergency and referral cases 7 to 80% is there. So this is the probable solution is telemedicine. So if you want to visit, suppose any good nursing home, CMC or Apollo, so you need to take some appointment, then your fooding, lodging, your time, each and everything is lost. So in that ground, that is in the telemedicine plays a big role, right? So as per the WHO's report, the approximately 17.5 million people die due to the heart attacks in each year, and more than 246 million people suffer from diabetes. So it will be increasing, that is 380 million by 2025. Okay, and almost 20 million people will die from the cardiovascular disease in 25, that you know. So that's why prevented in the help of the W-band. So yesterday we have discussed that it's a wireless body area sensor network based telemedicine platform. Because of that, we are extracting the information from the body owned sensors. So that means this is the market strategy as for the BCC report 2016 till we have presented. And motivation means first any work you need to means observe what is the motivation of the work behind the work. So patient loses the days wages and has to pay for travel expenses. Appointment with doctors is not guaranteed. Many cases are extremely trivial and of non-emergency type. So doctors charge a lot of money. So this is the present scenario. If you would like to move from the good clinic, so that's why first day people, then your auto, bus. This is the route basically. So that's why time and money and appointment, each and everything. And you know that is a today's we are going to the very busy and tight schedule. Okay, so that's why that is a time is the big factor. Time management. Suppose someone having a means money, but time they don't have much time. Okay, so time and money that is you need to balancing, right? And on the other hand, some manual errors are there, and which is mean that inconsistent in the data, but loss of reliability, redundancy. On the other hand, physical danger to the data, like aging of the paper documents, water, bugs. So in that ground, that is your solution means your telemedicine solution. Here, collection of survey data in the health record sheets that can be typing in the computer, then electronic EHR. Already you can maintain the data, and that is and from the database, online database, that is a report can be generated. Okay. So telemedicine that is plays a big role in also cover the different sector like home care, but disease management, disaster management, continuing medical education for public awareness, disease surveillance, remote consultation, critical care monitoring, so and complex interpretation. So these are the things are there. Okay, and here that is you see that is in this diagram, like your if you consider that is your uh, main city like Delhi, Mumbai, Chennai, Hyderabad, Calcutta. So that means that is this is the major hub, that means towns. So here that is a multiple number of other cities. Suppose means your Hyderabad, then your Tirupati, Bangalore, Kakinada, Vijayawada. So you need to collect the data through this path and through the this is the telemedicine platform basically. So if you'd like to process the data from suppose Bhopal to Tirupati, so that means this is the main line actually. So in this line, this is the two types. One is the lease line, or another one is the VSAT link, the PSTN link. PSTN means your public switch telephone networks. So that's why lease line means your bandwidth occupancy C, that is a 2 Mbps data. Okay. So that means this is the path basically. So that's why path and data rate. Suppose we are extracting the data from the rural area, that means this is the through local area networks, the small area network. So here bandwidth requirement is very much less. But when you are process the massive number of data at a time through the path, through the sharing path, in that time your bandwidth requirement is high, right? Scope of telemedicine. Telemedicine types means your teleconsultation between multiple carriers without patient involvement, one or more carriers and the patient by real time and store and forward. Two type of modes of communication is two types. One is your real time basis, another one is stored and forward approach. Okay, for emergency data, that is a live data you can transmit. That means this is through the teleconsultation. Another one that is you store the all patient centric data and at a time you can send to the server end by doctor side. Another one is the tele-education, telemonitoring. Telemonitoring means transfer the clinical information basically. And then your telesurgery. Yesterday we have discussed means regarding to the robotic surgery. Okay. And security means yesterday also we have discussed using the help of the means lightweight encryption model, like your federated based uh, approaches in the help of the blockchain, how telehealth sector can provide that is your uh, uh, good resources to our society. Okay, good advantages. This is the one of the major advantages features. So that means security, the major issue here, that is your requirement, challenges, attacks, means advisory, risks, consequences. So different services are also involved in this case. So main requirement of security mainly the confidentiality, integrity, authentication, availability, data freshness, non-repudiation, authorization, resiliency, fault tolerance, self-healing are major challenges in computational limitation, memory limitation, energy limitation, mobility, scalability, communication media. So these are the main points. Basically, these are the challenges. So that's why in the yesterday briefly we have discussed that is what are the major challenges involved in telehealthcare, but means telemedicine systems, right? The main benefit of the IoT-based telemedicine system, it cut down the medical cost, improve the patient experience, enhance the manageability of the medical drugs and medicinal adherence, and dramatic reduction in errors. The error reduction is one of the major part. Because of that, that is a medical data means it carries the most emergency data. Next, better control over wastage in the healthcare sector and better outcomes in the medical treatments. Right. So this is the one case study. Means here basically the epileptic seizure detection under telemedicines. The means we have developed and developed one particular model for, and as well as means analyze the performance of the gamma band in EEG electroencephalogram signal using the short time Fourier transformation. So seizure means is defined as a sudden synchronous activity of group of neurons to produce the sudden spark in the brain activity, and this is repeated seizure. This is it is defined as the epilepsy, right? So epilepsy is the chronic non-communicable disease of brain, and on the other hand, and here that is most of the people, most of the population are facing worldwide in this kind of problem. So one seizure does not signify epilepsy, and around 50 million people worldwide have the epilepsy. So that means this is the one of the major issues. Uh, so that's why in the help of the telemedicine, that is we have developed one particular model. So EEG basically, that is a electrophysiological monitoring method to record the electrical activity of the brain. So that means you're the recording means a pulse, generated pulse, and we are processing the pulse by curve. So that is a non-invasive technique, low cost and high temporal resolution, and EEG waveform are widely used in the diagnosis of the epilepsy and brain-computer interface. So here you see that is a invasive, non-invasive, and partial invasive. So that means here the brain is there. Then this is from the scalp, skin, scalp, and brain. Then non-invasive recording electrode. Then invasive recording electrode. After that, we digitize the data, binary 0101. Then these data processed through the signal processing toolbox. After that, that is a control external device, like a wheelchair or the cursor of screen or means a prosthesis. So after that, your feedback or visual or auditory can be generated through our means of auditory voice. So ERP recording setting means EEG measures the activity of the large number of population of neurons, and it is first recorded by Barger in 1929. And these recordings are non-invasive, painless. The electrode measures the voltage difference at the scalp in the microvolt range. And this is the setting basically the invasive and non-invasive and partial invasive. Next, see the diagram. Here, normal EEG pulses are there. So that's why this is the normal state. But abnormal means some random spike. So that's why this is the normal EEG, partial seizure EEG, and generalized seizure EEG. This is the three techniques, right? So this is the frequency bands, delta, theta, alpha, beta, and gamma. This is the frequency and association. This is the standard value, like a 0.42. This deep sleep, drowsiness, creative inspiration, or deep medication. These are the points basically, and this is the frequency ranges. And the promising potential of the emerging IoT for interconnected medical devices and sensor has played an important role. Here, that is a signal enhancement, watermarking, other related analytical by analytics will be used for avoid the identity of the theft and clinical error in the by the healthcare professionals, right? So this is means the model is the cloud-based health IoT system for epileptical patient monitoring. Here, things and devices are there. Then we acquired the signal. What kind of signal? This is the EEG data. This data processed through the means your router by intermediate device. After that, it is stored at the means of cloud end. Then secured accessing patient information by the health expert. And at the end, that is accessing the feedback by the patient and caretakers by service in case of emergency and patient monitoring, right? And this is the database basically. Here, 5 different classes named Z, N, O, F, S. Actually, EG data consists of 5 different classes. That is Z, N, O, F, S. So each class consists of 100 segments acquired from the individual channel of duration of 23.6 seconds actually. That means 4097 pulses per sample, right? And here watermarking method we have applied. Because of that, that is we have received got the very good response from here. Next, major motivations behind this work, basically the major issues in the healthcare system in the protection of the privacy. On the other hand, that is you need to register the clinics and healthcare sector. You need to protect the information from unauthorized access. Security breach of patient's monitoring device, but data may cause the patient social means embarrassment by mental disorders. These are the techniques are there. So that's why the data protection in the form of the watermarking and authentication is very much important in a cloud-based IoT health, right? And in that case, that is a different classifiers we have used because of the 5+ problem. So that's a random forest classifier we have used and achieved 90 point something the accuracy, as well as computational complexity we have measured, and as well as that is some predictive in the help of our proposed predictive model that is we can assign that is this is the random, this is means a normal case, this is the abnormal case based on the feature value, right? On the other hand, the another work basically related to the remote chronic wound monitoring. This is the means machine learning based approach, right? What do you mean by chronic wounds? Chronic wounds basically the rural people, rural aged people more than 60 years old, right? They are facing several chronic wound types problem. So that's why wounds mean this is the ulcer, basically. So that's why it can be categorized in 5 major important part like your venous ulcer, means diabetic ulcer, pressure ulcer, malignant ulcer, pyodermatous gangrenism ulcer. So here in the first stage means the patient observe that is he is having the red color. Red color means this is the granulation tissue. So that's why this is the connective tissue. And slab means this they remove the outer layer and denotes as the yellow color. And necrotic tissue is the dead tissue. It denotes the black color. So that's why this is the ROIB model: red, yellow, black, right? And tissue variation basically granulation tissue, slab tissue, and necrotic tissue. So the conventional clinical wound assessment, here you see that is a spatial measurements like your rural ruler-based method, but transparency tracing by line cast and visual grading of the healing process mainly depends on the area. So such subjective evaluation are inaccurate and painful. The ambiguities are there, and the inter-observer variation affect the wound classification. So that means your manual tracing method বা manual observer manual healing process is very much painful and inaccurate. So that's why your automated diagnostics tool are highly recommended. So that's why that is a I have characterized means that is a means first of all you need to find out what are the limitations on your present work. So that's why this is the lack of the qualitative assessment. So that's why our objective that is how to enhance the means your qualitative assessment. Limitation is based on color and texture. Motivation means this is mostly depend on the color. Because of that, first red, yellow, black, RYB model, granulation tissue, slab tissue, and necrotic tissue, right? So these are the points, and this is the highly expert dependent. So that's why automated system is required, limited access to the modern technology. So that's why your affordable and accessible framework is required. There is no community database is available. So that's why our objective that is how to develop the community database. Okay. So that's why in the moreover in developing country and such as India, the poor access to healthcare, inadequate clinical manpower, poor healthcare infrastructure and less literacy rate. So that's why need for developing and integrated technology for the chronic wound management. So that's why telewound monitoring system we have developed, and this is the purely the computer-aided automated wound diagnostic tool, right? So these are the literature that is a from the international point of view. You observe there is no means case studies there, but distribution of the tissue types in the 5 categories of chronic wounds and comprehensive software for the automated chronic wound image screening and management is not available. And national point of view, we see there is no community database is available. So that's why that is we have proposed some community database in that case. And the proposed system model, this is basically the means a telewound monitoring, and here left hand side you see that is 3 parts. One is your data acquisition module, wound data acquisition module, middle part is data transmission module, and right hand side that means wound screening and diagnostic module. So in that case, means your the left hand side we are acquiring the data from the body on sensor, like an image sensor. We are taking some images. That's why your camera is there. That means camera involves the image sensor. So that's why through the image sensor we capture the means your ulcer type images, and these data can be processed through the Bluetooth means .15 family or .11 family that yesterday we have discussed. IEEE the 802.11 means WLAN, IEEE 802.15 that means the WPAN or personal or passive networks, personal family, right? So that's why in the help of the short range communication mode, you can transmit the data through to the coordinator then, and coordinator basically receives the means your place and clinical information as well as image data. So here that is we have proposed some metadata concept like metadata. Metadata concept of 2 parts, left hand side your clinical information and right hand side your imaging concept is there. After that, that is we have applied some compression method, different compression techniques are applied, and then that is in best effort algorithm, but best suited algorithm we have considered. After that, this compressed data we have processed to the server. That means your CAD module, and CAD module here that is a wound database is also associated with this. After that, your in the help of by using unique patient ID, your patient clinical information can be stored in the wound database. Or on the other end, that is your imaging part, means ulcer part, that is a process to the medical, means your image processing tool works. And then you can apply pre-processing, segmentation, feature extraction, classification. After that, based on your classified result, doctor can prescribe, and this information, that means the diagnosis report, but diagnosis report can be processed through the telemedical agents to the patient. So that means this is the major importance of the telewound monitoring, telemedicine and telehealth So that's why that is a means we have proposed in this kind of work. Here that is a working model, basically the patient 1, patient 2 and patient n. Here that is a two parts. One is your image acquisition and clinical information that I told you, and both data can be incorporated by added with the under the means metadata concept. Metadata means image with patient information. That means several number, n number of patients are there, and these data coming to the CAD tool. CAD means your computer diagnostic tool. That means your image processing tool. So total these work, and this is known as means your telemedical hub, right? So that's why this is the proposed methodology. That means here we have applied some metadata concept. And chronic wound image analysis, in that point of view, you see that is the first you read the image from metadata, then your pre-processing images are there. Like here your color correction, image pre-processing means your color correction, noise reduction, color homogeneous, and these are the steps. After that, your color space selection, and here we have considered 45 channel, right? And then your wound area segmentation, feature extraction, and then your pattern classification. And finally, we are getting the correlated analysis for the healing rate, right? And database point of view, that is, we have developed our own benchmark database. That is, we have extracted the information from means primary wound database. Another one is we have collected the data, collected the patient-centric data from the two hospital, DSH and MMC. DSH from Jharkhand, one is from West Bengal. And we have manually we have collected, and finally we have developed our own community database, right? So I think that is a 15 lakhs 70,000 around feature value we have considered for this work, right? So this is the steps of pre-processing. Pre-processing, that is a fast color correction is required, and noise reduction 5x5 median filter we have considered, filtering, combined gray world and Retinux method. After that, your color space transformation YDVDR we have considered. Then after means getting the means best suited result and process to the segmentation module, right? This is the pre-processing sector. Here you see the original image is there, and left hand side this is the illumination corrected image in the red color. That means your green is the constant, you know, for Retinux. Grayscale means your Retinux theory you have already studied. So that's why color is the, again I am saying that is a color is the main clue for this ulcer imaging, right? So in the help of gray world assumption by Retinux theory, that is a that is used for the automatic and the color correction method, and green this is already constant. You see the alpha and beta value. So that means this is the in red color and green color in figure number B and C. You can observe it. After that, 5x5 median filter we have used to remove the salt and pepper noise. And on the other hand, that is for different parameters like MSG, PSNR, SNR, and mean absolute errors we have observed. And finally, we observed that that is your median filter. It provides the better response. Here, more than around 45, around 11 to 13 filters we have considered and compared. Okay, in the help of the mean contrast results, basically. Next, this one. This is the color space selection. Here, 15 color spaces. We have considered 15 means 45 channels. And we have measured the contrast value. Contrast means your wound affected region with the background, right? So that's why mean value we have taken. And here we observe that YDVDR, one is the luminance, another one the true chrominance is there. So that's why DB channel provides highest mean contrast value. We have considered that particular DB channel results, right? So that's why in the filtering stage, 5x5 median filter output, and here that is a DB channel base. 5x5 median filter with DB channel till color space selection we have considered, right? See the diagram, and here that is the original images are there. After color correction, this is the representation you see from this diagram. After median filtering, you see what will happen. After anisotropy diffusion filtering, see, And on the other hand, that is for YDBDR for DB channel, this is the output. These DB channel from the pre-processing unit, we are processing to the segmentation. Because of the pre-processing, then segmentation. So that's why here DB channel output we have considered. And this data we have processed to the segmentation stage. So see the diagram. The choose DB channel. After that segmentation module, here we have applied k-mean clustering and fuzzy C-mean clustering and special fuzzy C-mean clustering. But finally, and that is in the help of different parameters, different measures, you know, that is segmentation accuracy, Jaccard coefficient, dice coefficient, false positive rate, false negative rate, sensitivity, these points are there. So here you see that is a proposed methodology. Here number of images we have considered 96. Color space modified DB and DR channel we have considered. Modified means we have just normalization point of view, weighting function we have added. Then region of interest mean wound tissue and area. Segmentation methodology, three segmentation methods we have applied, K-mean, fuzzy C-mean and FCM. And here we observe that a fuzzy C-mean provides the better response with respect to other segmentation methodology. That means in the pre-processing stage, we have considered DB channel, and till segmentation stage, we observe that the FCM, DB FCM provide the better segmentation accuracy. And these data can be processed to the next stage. So see, this is the means your this is the output segmented region by K-mean, DB and DR channel, segmented region by FCM, DB and DR channel, segmented region by special fuzzy C-mean and DB and DR channel. So this is the representation. So that's why here that is a FCM, it provides the better response. And see the diagram. Here this is the original chronic wound images, left hand side. Then your ground truth images. The ground truth images. After that, your K-mean clustering, fuzzy C-mean clustering, and your special fuzzy C-mean clustering. So that's why these are the segmentation method. We just segmented the chronic wound images, right? Next, your wound classification. Because of that, this is the steps involved for chronic wound image classification. Based on the selected features, the wound tissue classification is done by the following steps, like your after segmentation, then your feature extraction is required. Then your selection of the training data and classification scheme. Here that is a Bayesian classifier, linear discriminant analysis, LDA we have used, and then decision tree and random forest. These are the machine learning models we have applied. Because of that, our objective is that is how to find out means the better accuracy, and for that particular accuracy, that is we need to consider this kind of means automated diagnostic tool model under the telemedicine platform, right? So then decision and classification output, tissue characterization, post-processing data, and the accuracy assessment, right? So feature extraction, that is a generally feature extraction can possible from the measurement image data. Tissue region means separating the RGB channel from the color intensity value, red, green, and blue, right? And here total 96 images we have considered. And 96 images here, number of granulation tissue 35, slab tissue 25, necrotic tissue 20, and some unknown tissues there 16, right? And then your 7 different intensities information are involved. So 7 different intensities information means extracting from each image and database is stored in 3 different databases. So actually separately you can create a 3 folder, right? One is your green portion, you can crop the images. The green color you just store in one folder, yellow color stored in the another folder, and your means black color stored in the another folder. That means this is the feature value, right? So training data set here contains is around 14 lakhs 41. Okay, sorry, I previously told that is a 15 lakhs 70. This is the 14 lakhs 40 1000 somethings. Okay. But related to, but compared to the other existing literature, we observe the maximum they consider 7 lakhs, 6 to 7 lakhs feature value. But we have considered around the 14 lakhs, over the 14 lakhs data set. Because of that, manually we have collected the data. We have not depended only the standard Meditech database. We have merged the data from the manual collected with the online available data set. So that's why that is our feature data set uh, is a high category. So that's why it contains total 14 lakhs pixel information, where 4 lakh 86 granulation, 7 lakh around slab tissue, and 2.5 lakhs around this is the necrotic tissues are there. So this is a main important part for this work. Because of that, if you have a means suppose you are showing good accuracy with minimal data, that means it's irrelevant. So always is try to enhance your database. Try to enhance your feature value. If you are having a large set of data, after that you can apply. Suppose you are getting means so 70 to 80% accuracy, then okay. But in low or you are suppose you are getting more than 90% accuracy based on the minimal set of data, that means this is meaningless. So just keep in mind in your future, it means your research work. But thing is that that is a kernel density plot is required. Because of that, your feature value. Now we are playing with the feature. Okay, feature optimization. Uh, my another work that is in IEEE JVHA in the published. There's a very good paper for the feature optimization part, because of the different features are there. So how to improve the model in the help of means so suitable feature means optimization methods. Okay. So in that case, here consider means we have considered 7 measurement parameters: RGB channel from RGB, L and V channels from LUV, B channels from LAB. Why B channels from LAB? Because of that it provides the highest contrast value, mean contrast value. H we have considered because of that H channel of HSI, whose saturation intensity, it provides the better means your contrast value. So that's why we have considered. All right. So kernel density plot generally used to distribute the features and estimate the probability density function PDF of features with respect to the different tissue classes. So that's why here you see granulation, slab, and necrotic, 3 type of tissues are there. Mainly our objective is is it highly overlapped or less overlapped? So less overlap is always better. So that's why in this diagram you see few intensities have less overlapping region, that is a red, among the 3 tissues, right? Here the observation is same. You see this is the less means overlapping is there in G and B among the 3 tissues. So that's why kernel density plot we have considered. Because of that, that is a we want to see that is a how much overlap, how much highly overlap, how much is less overlap, and less overlap is always better. Okay, because of the easy to means identify. And this scenario you see from the LE view means color space model. Here same thing. This is the means your less overlapping model. In that case, you see that is a in the class conditional density plot. So of the B channel of LAB color space intensity information. Here observation is that is a means some intensity is highly overlapped. You see the diagram, that is a highly overlapped region. So highly overlapped region means that is you are unable to get the good accuracy of the model. Okay. So that means your this is the granulation slab and necrotic representation, and in the help of the means your kernel density, case density plot. Uh, so that's how we can identify that which one is highly overlap, which one is less overlap among our 7 intensities, 7 intensity values, right? Next means segmentation part, pre-processing, segmentation, feature extraction is done. After that, your telematical hub it receives the large volume of data appeared in a high speed. So that means level data may be very scarce, and it's only a limited amount of training data for building the classification model, and it is poorly trained classifier as a result. And you know that is a manual leveling of the data means very much costly and time consuming. So in that case, that is a naive-based model we have applied. So naive-based classifier mainly correctly predicts the class levels of the unseen independent case and probabilistically predicts the chance of being classified in the class and where posterior probability is the maximum. Next, linear discriminant analysis method we have used for maximize the class separability in the reduced dimensional space. On the other hand, that is searching a linear combination of the variables and provide the best separates the two class issues. A decision tree calculates the class membership by repeatedly partitioning the dataset into the uniform subset. So that's why these are the method. And 10 decision trees becomes a forest. So that's why 10 decision trees model we have considered, and it creates that is a your random forest model. So random forest model in machine learning techniques, you see that is the most powerful nonlinear statistical classifier used for the analyzing and classifying the wound tissue. It uses the decision tree as base classifier. It generates the multiple decision trees. It improves the performance in terms of the accuracy and time required for means wound classification method. And ensemble learning scheme like your set of decision tree used output will be measured in the based on the majority voting. Okay, majority voting. So that's why that is a decision tree and random forest we have considered. And the final end of the day, that is a we achieved that is a very good response in the help of the random forest model. So here input mean number of training data set, number of feature space, number of trees, number of classes, and number of testing data set. And output is the random forest. All right. See the diagram. That is the left hand side. This is the crop. Different colored portion extracted from the different tissues, granulation, slab, and necrotic. And right side means this is the labeled by the expert dermatologist. This is the manual observer, manual and automated. Right. So that's why the performance analysis in that case, that is a because of that we need to provide the better accuracy. So in that case, accuracy in terms of the ground truth, automated results can be generated, can be compared with respect to the ground truth images. So here, random forest, linear discriminant analysis, naive-based and decision tree have applied in the different tissues, and finally we are getting the average value. So here we observe 93 point something, 93.75 achieved in the help of the random forest model. And this is basically the comparative tissue prediction with the ground truth image using the 4 different classifiers. So you see this is the representations of granulation tissue, parallelly for slab tissue, parallelly for necrotic tissue, means a black color, right? So on the other hand, that is we have compared this data with means existing database. Like I told you that is a Meditech is a standard wound database. You can find the dataset from the Meditech. So that's why we have compared with the existing methods with our proposed scheme and proposed scheme based on the same dataset. So that is we achieve 93 point something accuracy. So here we have applied, so our model is already fixed. We have developed the automated diagnostic tool. And then we processed the different images, randomly we have processed. And then the percentage wise, we achieved means one by one. Like suppose this one, here granulation is 74. So 74% granulation means this is the red color is there. Red portion is more. That means this is the first stage of the ulcer. After taking the medicine, suppose your yellowness is better. Suppose your slab is 50%. That means that it is recovering. Okay. Suppose we are getting the necrotic 39, but means your more black color is there, black portion is there. That means this is the totally the recovery stage, right? In the transmission of the images, transmission means we have discussed transmission after acquiring the data in the help of the image sensor, image data, and patient-centric information can be processed through the proper communication path from body body to coordinator and coordinator to telemedical hub and telemedical hub also connected with the different doctor enable sectors. So that means three networks. One is your band networks, body area networks. In between, that is for your 2G, 3G by internet is there. Otherwise, that is your telemedical hub means your outside by backend network is there. Okay. And then here that is a first stage we have cropped the images manually because of that if you sending the large volume of data that means your bandwidth requirement is high, your cost will be cost structure will be high. So here we have applied the asset partitioning hierarchy tree. So SPHT, that means this is the wavelet based concept. The quadrature partition into the quadrature means partition in the wavelet transformed at a given threshold. So one is the JPEG, another one is the SPHT, another one is the crop image. So this portion we have processed. So that's why first we read the images, then convert color to the gray images. It convert the binary format. Then BPSK binary phase shift keying we have applied because of that for long term means long distance communication. BPSK is better rather than the QPSK. Then your modulation demodulation part. After that we calculated the means your bit error rate as reconstructed the signals and images actually. We have compared with the bar and SNR and see the diagram. Here this is the original images are there like your segmentation accuracy, Jaccard coefficient, dice coefficient, and sensitivity. And based on this, that is we observed SPHT compression method provides the better response. Last one, 98 point something. So that's why that is a SPHT based compression method we have considered for transferring the means your patient centric information from one side to another side. Then your Android based one part is there that is a development of the community database of the chronic wound images. And see, this is a belongs under the mHealth and eHealth, mobile health and electronic health. It includes the use of mobile device in collecting, aggregate the patient level health data and providing the healthcare information to the practitioners, the researcher, patient, and real time monitoring of patient vital information or directly provision. So as extra in that case, that is a metadata part consists of that is a patient clinical information as well as your image data. Both are embedded in a particular case. So metadata means your clinical information means name, ID, sex, DOB, address, wound site, and wound location, telephone number, year of diagnosis, comments, previous history, all belongs under the particular clinical information stage. And right hand side, that is we have not only considered the one single image, but we have considered the means three different images. Okay, three different images, right? And these data we have processed through the means telemedical uh, mm, uh, stage. So here this is the community owned database development. We have developed that is in the Android app based solution. One patient sign in, patient sign up, and doctor sign in. After that, you register image. When you are registering the portal, and then automatically you will get means your the registered ID number. That means it's a unique number, and lifelong you can use the same number also. And in the help of this unique patient ID, PID name, that is a you can process your data through the telemedical agents. So many agents are there. Agents mean this is the training by trained staffs, by expert staffs. After that, and this data can be processed to the doctor side, right? So this is the diagram, and I have taken the images. This is my actually the 10 years back research work actually. So here you see that is in this is the means your portal, doctor portal, patient data, and web page access is there. Clinical information portal is also be there. This is telephone monitoring, right? And you can upload your the picture of the wounded part that you have uploaded. And finally, this is the doctor portal. Doctor, it is observed, seen, yes or no. Like the first few no, 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 and the last one is yes. Doctor is observed. Okay. This is the screenshot of the doctor portal. And this means that their own doctor feedback is also be there. So doctor feedback can be communicated to the patients via a telemedical agents. Because of that, that is in the last means yesterday we have discussed that is a multi means linguistic problem. Okay, multi-language. Because of that, local people is there, they are unable to uh, mm, medicine by obey the doctor words with his term. This is difficult actually. So this is the diagram. In that case, MySQL, PHP have considered and surveyed to several research articles and designed the metadata for the dermatological imaging. Oracle platform, SQL, MS Access, XML, and SAS8, PHP MyAdmin. So in that case, that is we have applied. So finally, we have seen that that is a cost effective and license. But so that's why low cost, open source, very much compatible, easy to access solution is there required. So that's why MySQL PHP we have applied for designing this kind of Android based app, right? And end of the day, that is a validations I have taken. So that's why my work is validated from the Germany Professor Thomas Wild. Uh, this is the year 2014, I think, 15 July. And this is the national experts. National expert means the manual doctor observation. You see, this is the images. This is the original images. This the based on the color. I have shown these images to the doctor. Doctor is whole naked eye observation. He predicted the results. They okay in nearly means the 39% readiness is there. But our automated tool generates no. This is the around 51% red color is there. So that's why automated diagnostics tool is always better for long based means distance based treatment on any others. So that's why the telemedicine provides the better response in this regard. Okay. So okay, so this is the clinical validation, and this work is also validated by the IIT Kharagpur. So Professor Mitra and the MBBS MD, PhD also. He's also the validated the work. So that's why validation is required for each and every medical imaging based core work. Suppose this is not a good way that you are doing some kind of image processing work. You are working in the medical field, but your work is not validated. Uh, suppose you are getting a good accuracy, okay, we can try for the good journal transaction. It is not a good way. Proper validation is required for each and every medical based works. Okay. So today that is in yesterday and today we have discussed the different challenges, barriers, issues, and as well as a few case studies we have discussed. Each and this is the chronic wound imaging and chronic wound imaging, or you can say epileptical seizure detection. So in that case, you can see this is means what will happen, but what is the important role can mitigate our means your major health concern related data. Any question? If you have any question, you can ask me.
Yes, sir. Participants, do you have any questions? I think there is no question, sir.
All I know that is all are very much experienced in this field,
Yeah,
but no.
yesterday. Thank you, sir. Thank you, Chinmati Chakravarti, sir. For
Okay,
yeah,
okay,
sir.
okay.
Thank you very much, sir.
Thank you. Yeah.
Today, 2 sessions are completed. So tomorrow we have the sessions of quantum enabled technologies for telehealth industry by Dr. S. Kranti Kumar. And session 8 is the Internet of Medical Things by Dr. Aarti Rangarajan, Professor SRM University. So as usual, 6 to 9 o'clock, the sessions are there. So once again, I am taking the attendance directly from the meeting. So that report I am updating in the ATAL FDP also every day. Send feedback, and feedback is enabled after submission of your attendance. Send the test we will conduct on the last day, Saturday 6:30 onwards. We will conduct this one, and material I will share to you. So 30 questions we will that is objective questions we will give. So that marks we can upload in your test marks in the ATAL portal. So then after that you will get the certificate. So thank you all. Please leave from the meeting.